Good evening, ladies and gentlemen. In this video, we are going to mostly, for 99% of it, focus on your blood platelets and how they work and the 3 objectives associated with those platelets. But first, taking one step back to blood objective 9, I missed a disease with your white blood cells, and I apologize. Occasionally, sometimes, the monocytes in your spleen can become infected by a virus called the Epstein-Barr virus. This is more commonly known as infectious mononucleosis, or mono. Typically what happens if the Epstein-Barr virus has gotten a hold of your monocytes in your spleen, it will cause a few issues because it's a virus that is attacking your immune system. So you'll end up with headaches, chills, a very bad fever. You're going to be very tired and fatigued. Probably going to have pain around your stomach and spleen area. Generally speaking, this mono is also called the kissing disease because it is contracted and transmitted through saliva, mucus, tears, other bodily functions, but the kind of thing that you are more likely to swap with more individuals when you are between the ages of 15 to 24 years old. So this can also be called the kissing disease and is more common amongst teenagers. So you're going to have a high fever, so 101 to 104. Go to the hospital if you ever have a fever above 104. Sore throat, pain in your left upper quadrant because your spleen is going to be swollen and enlarged, which is not good. Because that's also pushing on your stomach, you're going to have loss of appetite, plus the body aches and feeling bad. Your treatment for this would be rest. Whatever you do to normally soothe your sore throat, like drinking tea, ibuprofen, try to be chill with low energy or low impact activity, and you gradually increase your activity until your body has fought off the virus. In very, very bad cases, the doctors may put you on bed rest, but that's pretty much it for mono. It can take a long time to get over this disease and illness. That being said, now we are on to our platelets. So, we need to discuss your platelets and your body. Blood objective number 10 is describe platelets in terms of structure, function, and development. And blood objective 11 is describe the steps associated with hemostasis. Discuss factors that regulate clot formation, including undesirable clots. Right? So, you guys have seen and played with your own platelets. Platelets are the tiny itty-bitty blood cells that float around. Remember how tiny they were in comparison to your red blood cells here? Platelets are super tiny, and they help your blood clot after you have been injured. They are clotting agents. So they are small, tiny fragments of megakaryocytes, which are the bigger parent cells of platelets. And they secrete granules they have little granules that secrete all of the chemicals that help and produce the clotting process of your blood. So platelets are absolutely essential for the blood clotting process that occurs in your blood plasma when blood vessels are ruptured or something has happened. Right? And this is internal or external illnesses. So every time you are bruised, the reason why you're bruised is because when you hit your hip on that, the corner of your kitchen table because you were trying to sneak downstairs for a glass of water in the middle of the night and it bruised, that's because you hit your hip on the corner hard enough to burst some of the smaller capillaries and blood vessels underneath your skin, and they have clotted, and that now needs to be cleaned up and healed, so your platelets helped with that. And if you have an external injury that leads to the outside world, such as a paper cut, the most painful of injuries that we will discuss as an example today, your platelets also clot that wound, right? So they are temporary plugs that help seal the break that begin the healing process, right? Platelets are formed after your hematopoietic stem cells tell you that you need more platelets. They make a megakaryocyte, and the megakaryocytes, as they get older, break off small pieces of themselves that become platelets. So your megakaryocytes make megakaryocytes. They basically break off little pieces of themselves into the bloodstream. That's called platelets. Platelets, by the way, can also be called thrombocytes if you are comparing to your lab list. Platelets and thrombocytes are the same thing. Please don't freak out about that. All right, both answers are correct. So, hemostasis is the stopping of bleeding. Stasis means static, still, it needs to stop. Hemo means blood. So, what's going to happen when you have an injury, right? You go through some steps. So the first thing that happens after you have accidentally injured your soul with that blasted paper cut is you're going to have some vascular spasms. So the blood vessels around where that paper cut happened, they have some smooth, like all blood vessels have smooth muscle layers in them. And those smooth muscle layers are going to contract, which causes vasoconstriction. So those blood vessels are going to constrict a little bit because you tore the blood vessels a little bit when you got yourself the paper cut. At that point in time, platelets find the little tear and a platelet plug forms. So the injury where the lining of the blood vessel is exposed to collagen fibers, platelets stick to those collagen fibers. They show up and they start sticking. Platelets are also going to release their own chemicals that make other nearby platelets sticky and stick to them. So the platelets are basically grabbing other platelets and sticking platelet upon themselves. This causes step 3, which is coagulation, because the platelets form a protein called fibrin, and fibrin, like a spider web system, sort of forms a spider web-like mesh that covers the platelets and traps other things like white or like red blood cells to the area until the liquid portion of your blood and other red blood cells can't get through that tear anymore. So you end up with the platelets causing a pile of other platelets and a mesh net of things like red blood cells holding together and forming a clot or blockade where the open tear into your blood vessel was. And that's what a clot is. That's what a blood clot is. Later on, you will notice that you have a scab where that paper cut once was, and once the skin tissue and other things have healed from the blood vessels back up, underneath that scab, the scab and this blood clot of platelets and old red blood cells will simply fall away. That's what a scab is. Right? So, coagulation. This is your magical diagram, right, of clotting factors. So coagulation occurs in 3 phases where the blood is transformed from the liquid blood that we all know and love into a gel in a multi-step process that's going to involve a bunch of proteins and factors that are called clotting factors or procoagulants. Coagulant is when your blood thickens and becomes a clot, so pro means for or in favor of. A procoagulant is something that is going to be encouraging clotting factors and the like. We're just going to call them clotting factors. Right? So within hemostasis, phase 1 ends with the formation of a complex substance called prothrombin activator, meaning you have just received that paper cut and you are bleeding out of your paper cut and cursing the world around you because, oh, does that hurt your finger? Oh, so much. And from that paper cut and injury, your body is demanding thrombocytes or platelets. So it is creating a complex substance called pro, or in favor of thrombin, so in favor of thrombocytes or blood clots, activator. So this is a complex substance that's going to activate your platelets. Right? In phase 2, this prothrombin activator catalyzes or speeds up the conversion of plasma proteins called prothrombin into thrombin. So basically, you have just been cut. Your body is crying and calling for, please send the platelets. The paper cut is too much to bear. You have tissue damage here. My finger hurts. And your body is going to create prothrombin activator, and that is going to go into the blood plasma that you have and quickly make your plasma convert some protein into active enzyme thrombin. Right? Thrombin is going to catalyze or speed up the chemical transformation of your clotting factors called fibrinogen into fibrin. So you have some floating proteins floating around called fibrinogen. Until thrombin is made, that fibrinogen is just the building block in the Lego pieces to fibrin, but fibrin is the full-on protein hair-like complex that your platelets make to use as a net to catch things. So once those fibrin strands have essentially been formed and the platelets are sticking together, making those fibrin strands like glue-covered mesh nets, it's going to cover other platelets and themselves with those fibrin strands and sort of create a spider web around the injury to that blasted paper cut. And that's going to form the structural basis of your blood clot. So fibrin makers within you, it's going to make the liquid plasma become more gel-like because of this sticky spiderweb-like substance, and it's going to start trapping the formed elements like your red blood cells that try to pass through it. So in preventing that paper cut from bleeding out, it catches the red blood cells before they have a chance to leave your body. But those red blood cells are now trapped in the web of fibrin, and they cannot leave your body, but now other red blood cells are also cannot get past the blocking red blood cells and fibrin. That is the point of these blood platelets. So in the presence of calcium, that's your Ca2+. So when calcium is present, thrombin also activates blood clotting factor 13, which is a stabilizing factor for fibrin. And it's a cross-linked enzyme that's going to bind to the fibrin strands together and make them a tighter net. And it's going to make that mesh net even tighter and thicker and better. It's going to cross-link, further strengthen things, and that hole that was just plugged into all of your blood vessels is going to be sealed by the blood vessels and whatnot. If we're going to get complicated and complex in this picture has all of the information you need. So your damaged tissue from that paper cut cries out for prothrombin activator and makes it. That's your tissue factor. Factor 3 is then going to it's going to get calcium involved. You're going to have other clotting factors like clotting factor 7 involved. And factor 7 is going to then go to make factor 10 or factor X, which is going to make prothrombin and make thrombin, which is going to make fibrin and cause all of these little platelets that are clotting things together, clot together. This is how your blood clots function and work. So you have a series of these pathways involved. You have damaged tissue, it makes factor 3, which summons clotting factor 7, which then causes your tissue clotting factor 10 to happen, which then summons prothrombin activator, which produces prothrombin, thrombin, and then makes fibrinogen become fibrin. And this is how your blood cells clot. And that would be your extrinsic pathway, which is external tissue. So that would be your dastardly paper cut. Intrinsic pathways are within you. That would be your activated enzymes in you, usually clotting factor 7. Platelets and calcium get involved, which then add on to clotting factors 8 and 9, which then produce clotting factors 10, which clotting factor 10 goes directly into making your prothrombinase, prothrombin, thrombin, fibrinogen, and fibrin. But this is how your body deals with injuries from internal and external issues. Hemostasis, like we've said, is blood clotting, so you don't bleed out. And as clot retraction is occurring, your blood vessel is healing. The cells along the wall of your blood vessel begin to heal the hole that is within your blood vessel from the outside or injured area in. Platelet-derived growth factor is released by the platelets that are within the clot and stimulates smooth muscle and fibroblasts to divide and rebuild the blood vessel wall. So as platelets have clotted the injury and made sure you do not bleed out from that dastardly paper cut, it stimulates your smooth muscle and your other tissue layers to begin dividing and healing so that the growth process can occur, your blood vessels will heal, and then everything goes back to normal. That is what platelet-derived growth factor is. Right. And that is also, if you need another flow chart for how this works, this is one thing on your PowerPoint. You have your injury, right? You have the vascular spasms. The intrinsic pathway is when you have a damaged blood vessel wall. Clotting factor, like 7 amps up to tell 11 to do its job, which then bounces a signal back to 9 and makes 9 do its job. If you have had trauma from extracellular cells or extravascular cells, so trauma from outside the blood vessel, you make clotting factor 3, which then amps up 7. And either way, either clotting factors 9 or clotting factor 7, then go and activate clotting factor 8 and 7 or clotting factor 8 and 9. And both of these combined, either from the damaged vessel wall or the extracurricular or extravascular cells, inevitably, because this is 2 different pathways, it inevitably causes clotting factor 10 to occur, which then makes your prothrombin form, which forms thrombin, and thrombin makes the fibrinogen that's just floating around your plasma turn into fibrin, and then that turns into clotting factor 13, and you get blood clots with fibrin and all the other good stuff. So after you have had your vascular spasms, which have started this pathway, your platelets plug and form and block off the blood vessel so you do not bleed out. Coagulation occurs, that means all of it has clogged, and everything stands there until it heals. And that is how hemostasis works. Occasionally, we have abnormalities within our blood vessels. That's not a good thing normally. And this brings us to Blood Objective 12, which is discuss pathologies associated with hemostatic disorders, including symptoms and causes. So, the fancy term for a blood clot is called, or a clot that develops and persists in an unbroken blood vessel, is called a thrombus. So if your blood vessel was never broken and your platelets just got caught on something along the side of it, like cholesterol that had built up along the inside of your arteries or something along those lines, and it formed a blood clot, that blood clot in an unbroken blood vessel is called a thrombus. That can be very bad. If the thrombus breaks away from the blood vessel wall where it had formed and just starts knocking around your body, free-floating through your bloodstream and your blood vessels, it goes from being called a thrombus to an embolus, because then it is free-floating. It is not just a stuck blood clot, it is an embolus. An embolus is not normally a problem until it hits a blood vessel that is too narrow for it to get through. And remember, it is just a blood clot that is floating through you. When it hits an area that is too narrow for it to get through, then it's called an embolism, and that's going to obstruct the blood vessel. Blood clots from an embolus are going to be named different things depending upon where the clot occurs. So remember, a thrombus is stationary, so it's a blood clot that's stationary. An embolus is free-floating in your body. If you have something called a pulmonary embolism, it means that one of these embolus cut off the blood flow to someplace in your lungs, so you have a blood clot in your lungs, and that can be a very bad thing, especially if it ruptures. If that kind of embolus, if you end up having an embolism in your brain with the blood supply to your brain, we call that a stroke. This can lead to very bad things, especially if it cuts off blood flow for a long period of time. It is definitely something that can be fatal in the event of a pulmonary embolism, but is something to be concerned and worried about. Right. A disorder with your blood platelets, one of them is called thrombocytopenia. So, thrombocytopenia is a condition where the number of circulating blood platelets inside you is deficient. You don't have enough. So your body never made enough blood platelets, so you don't have the blood platelets there to just maintain, right, your normal appearance. So thrombocytopenia is what happens when you don't have as many thrombocytes as you should. So you have fewer blood platelets, and because of that, anytime any tiny itty-bitty blood vessel in your body or your legs bursts or breaks, it can't heal appropriately. So you're going to get patachiae, which is like this little spotted kind of appearance because of the bruised, unhealed, broken blood vessels throughout you because you don't have enough platelets to heal it. Probably the most well-known disorder for blood platelets is hemophilia. There are many different types of hemophilia. All of them are genetic linked, so mostly genetic linked X chromosome disorders, because most of these disorders are associated with the X chromosome. The reason why we see this mostly in men is, if you remember from regular biology, for mammal species, so humans included, males have the genetic structure of having an X and a Y chromosome, whereas females have the genetic structure of having two X chromosomes. If we have a mutated X chromosome as a lady, our secondary X chromosome that is not mutated picks up the pace and covers the slack of the first mutated one. However, because males only have one X chromosome, if their X chromosome is mutated to show hemophilia, your male has hemophilia and cannot clot his blood. There are different aspects of this. You are missing different clotting factors. So hemophilia B lacks clotting factor number 9. Hemophilia C lacks clotting factor 10. So all of those clotting factors in the clotting process that we were discussing a little bit ago, they're missing some protein or some part of that chain of events. Most hemophilia, or classic hemophilia, is hemophilia A, where you lack factor number 8, which was at the very beginning of that chain, if you remember. That's about 77% cases of hemophilia, but because of that individual's genetics, they do not have these clotting factors, so their blood will not clot. So, as a symptom of this disease, what happens to our individuals is they randomly bleed anytime any blood vessel is threatened or damaged, meaning they're going to have random bleeds from joints within their body, because your body has to repair things like your knee joints and that sort of thing all the time. So bleeding is going to impair their joint functionality. They're going to have stiff joints. Nowadays, this has to be treated by blood transfusions because they don't make the clotting factors that they need to be able to clot their own blood, so they tend to lose blood. So they can be treated with transfusions of blood plasma and injections of purified blood clotting factors, although that is expensive to treat and inconvenient for the patient. Right? And those are generally your treatments for this. Just generally your treatment for a genetic disorder. It is going to be lifelong, and it is indeed genetic linked. But that is the most common blood platelet disorder that you will probably see. Right? So blood transfusion are routine when a blood loss is rapid or substantial. Normally, your hospital or whatever will have packed red blood cells or whole blood from which most of the plasma and leukocytes have been removed, are preferred just so they can restore oxygen carrying capacity. In the case of hemophiliacs, they will include the clotting factors in there as well to help keep that up. But that's all you guys need to know about blood clotting and blood clotting factors. Just remember those lovely webbed mesh details of blood clots. And I will catch you guys on the next video. And the next video will be about blood typing and some of the last few objectives we have for blood. Thank you very much.